Joining me now is Dr. Amish Adalja with Johns Hopkins University. Doctor, always good to have you on. The goal of getting everyone vaccinated by the end of May, lofty. Getting our teachers vaccinated by the end of this month. Welcome news for teachers and parents, certainly. But is this doable?
I do think it's in the realm of possibility. Now that we've got a third vaccine online, one that only takes one dose, and you've got Merck and Johnson & Johnson cooperating on increasing capacity, it's becoming increasingly likely that we will be able to do this. Everything has to go right. There's still opportunities for error and unexpected glitches that might occur in some kind of in an endeavor this big. But I do think it can happen. And I think if we really approach this as a warlike effort, like we should have been from the very beginning, this could be something that happens.
Doctor, if we do reach that goal, as you say you believe we will, what will the impact be on the virus? Cases, hospitalizations, deaths?
So the first thing you're going to see is deaths and hospitalizations go down. And we're indeed seeing that already with nursing home cases down 85% and deaths down over 60% in nursing home patients. And then you're going to see less of an impact, but an impact on disease spread. Maybe not the 70,000, we won't see the 70,000 cases we're seeing every day, but that would get down to some number. We don't know how low it will go, but we have to remember that we're not going to eliminate this virus. It's not going to be completely eradicated. This is something that has established itself in the human population, and we're going to be dealing with it. But it's never going to be able to cause a public health emergency again, never be able to threaten the hospital's capacity. But it will put us ahead of this pandemic. It will put the pandemic as something in the past. And I think it will be a good news for everybody when we actually achieve that.
And the big question tonight, when you're seeing states like Texas and Mississippi roll back the mask mandates, open up business to 100%, the concern from a lot of people is we may be taking a step backwards. As a medical professional, what's your reaction to the states doing this tonight, and what effect will this have on the virus?
It's a little bit mixed. So when it comes to opening up businesses and going to 100% capacity, I'm someone who's always from the beginning said that needs to be tied to hospital capacity. And when hospitals have adequate ICU beds, regular beds, personal protective equipment, we're not hearing about them getting crushed. I think governors have some flexibility to do that. I think that's a good linkage, hospital capacity and restaurant capacity and the like, especially since restaurants have changed their modes of operation. The mask mandates and the norm of wearing a mask, I think, needs to be in place until we get a sufficient number of people vaccinated. If you look, for example, at Texas, they haven't done the best with terms of vaccination. I think about 12% or so of their population has received one dose of the vaccine. That's not enough to decrease community spread. So I would think that mask mandates need to be in place, especially if you're a business and you're going to go to 100% capacity. You want your customers wearing masks because you are likely to get an exposure with a percent positivity rate above 5% in that state. So from a business continuity or just a business integrity perspective, I think you're going to see businesses say, we still want people to wear masks. We're still going to enforce some social distancing because we don't want to have exposures in our business. We don't want to be known as a COVID business. We don't want to have to be shut down because so many people are getting infected here and have contact tracing and have our employees off in quarantine. All of that, I think, is going to hopefully get people to still behave as if they're in a pandemic, even if the government isn't forcing them to do so.
Far from out of the woods. Dr. Adalja, as always, thanks for your time.
Thank you.